So hello guys, welcome to our podcast. This is the first podcast that we are shooting and I am Dr. Pavan Gulhane. I am laparoscopy surgeon and oncosurgeon.
Hi, I'm Dr. Rasika Pise. I'm an obstetrician gynecologist and an IVF specialist.
So today's podcast is special because we are going to be discussing about a social media sensation that happened recently by the name of some celebrity, that is Poonam Pandey, and you're right, we are discussing about
Cervical cancer.
Yes. So we keep on getting a lot of DMs, a lot of questions from our patients, from the viewers, and we are going to discuss about those questions in this podcast. So shall we start?
Yes, let's begin. So, what is exactly cervical cancer and which part is exactly affected in cervical cancer?
See, the cervix is a part of the uterus. We also called it as a mouth of the uterus.
Correct.
Every female has a genital tract that starts from the vagina, and next to vagina we have a cervix. Cervix is the entry point of the uterus. So that is the only part of the uterus that can be seen from outside.
Correct.
And when the cancer affects this portion of the uterus, it is called cervical cancer.
So, what are the causes of cervical cancer? How does it happen exactly?
So traditionally, cervical cancer has been known to cause in the low socio-economic group.
Correct.
Where there is a poor hygiene of the females, there is a possibility of having early marriages, more number of children. So there are higher chances of sexual transmitted diseases. So the chances of having cervical cancer is very high in these females. There are other group of people or ladies, you can say, those are the girls who are exposed to the early sex.
Yes.
The girls who are exposed to
Multiple sexual partners.
they can have the start of this cervix.
And obviously, females who are not using barrier contraceptives.
Absolutely. So they don't get any protection from sexually transmitted diseases.
Correct. So what exactly is responsible for cervical cancer? How does it happen?
So cervical cancer, as any other cancer in the body, it has a risk factor and it has a patient's tendency to form that risk factor into malignancy.
Yes.
So the risk factor in this patient is mostly infection. Those are acquired by the female patient by the act of coitus, if you don't use contraception that we have already discussed. So what happens, you generally are exposed to the infection like HPV viruses. These HPV viruses are going to cause some erosion, or एकदम simple language में बोलूँ आपको तो it is a छाला or ulcer on the cervix.
Cervix. Yes.
And if it remains untreated and repeatedly exposed to the infection, it goes into the next stage, that is the precancerous lesions that we are going to discuss next about the questions that we have. And after that, it converts into the cancer. Generally, what we see traditionally, we see that the cervical cancer happens in the age group of 50 to 55 years and beyond.
Correct.
So it is a cancer of females post-menopausal. Once you attain your menopause, after that you generally get this cancer. But recent years that we are seeing these patients as young as 28 and 29 years, they start their sexual life early and they are exposed to multiple infections. And then they get the cervical cancer as early as 28 and 29 years also.
Yes. And we have also seen cervical cancer amongst the patients who are pregnant, who come to us full term. Also, I've seen some patients who have landed up in the OPD, and when we do the examination, they have cervical cancer and they are just about to get delivered also. I've seen a few patients like that.
I recently had a patient. That patient was just 28 years.
Yeah.
She was about to get married. And during the act of coitus, she had bleeding. So just went to our gynecologist to get her examined, and we found to have a large mass on the cervix, and that turned out to be a CS cervix at the age of 28.
28, yeah. So basically, nowadays, I feel that our age is no bar to have cancers. Earlier, it was like the people who are old, cancer is most commonly seen amongst them. But these days, I think youngsters, the age has decreased.
So it is very important for youngsters, specifically the school-going children, like the girls who are starting their menstrual cycle.
Correct.
They should be aware about all these issues. Because nowadays, we are seeing the surge of early pregnancies.
Yes.
Unmarried pregnancies.
Correct.
So the girls are being exposed to because of curiosity and a lot of things to the sexual act, and they don't use barrier contraception. They don't have knowledge.
I feel sex education is very important. Parents should be very free while talking to their kids. They should educate them about sex education. I feel in schools also, the more we talk about it, the more myths we burst around it, the more casual, I guess, we are towards it about the approach of having safer sex. I feel all these diseases, like they would,
and that is the point that has to be considered for prevention of cervical cancer.
Correct.
This topic comes immediately next to this, because the prevention start right from the beginning. You have to prevent the infection.
Yes.
And that is by the safe sex practices and sex education.
Sex education, yes. And barrier contraceptive is must, because you cannot prevent cervical cancer by any other contraceptive. You have to use barrier contraceptive, which is condoms.
Yes.
So what are the symptoms of cervical cancer?
So the patient with the cervical cancer generally presents with the white discharge or leukorrhea. They are, as we have discussed, they are generally postmenopausal patients. So if somebody is complaining of white discharge or leukorrhea very often,
And foul swelling discharge.
foul swelling discharge, so that has to be taken care of,
Yes.
or you have to evaluate the patient.
Yes.
Then there is a possibility of the spotting that she might be having.
Yeah. And at times the discharge can also be mixed with blood.
Yes, it can be mixed with the blood. There is one more symptom that is called as post-coital bleeding.
Yes.
Like after contact,
Contact,
you
there is
see
a bleeding.
because of disturbance in that ulcer that will lead to some blood, and you will see
Yes.
that. There are other symptoms, those are related to the cancer per se, but any cancer in the body, and that is weight loss. You are going to have decrease in the appetite, like you don't feel like eating, you're going to lose your weight, your clothes are becoming bigger for your size.
Yes.
So all these things are going to happen. So any symptoms, lady who is having white discharge and intermittent spotting should be evaluated by a gynecologist, and we should send something that is called as a pap smear.
Yes.
That the small test that gynecologists do as a screening.
Screening test. So how often we need to do a pap smear?
So it is recommended that after age of 35, you should get a pap smear done every year. So every birthday, on what I recommend to my patients is, whenever you have your birthday, like after 35, get yourself evaluated.
So how can we screen the cervical cancer?
So screening of the cervical cancer is absolutely easy. As I already told you, that is a cervix is the exposed part of the uterus, and that clinician can examine very easily. If you start your sexual practices early, then it is recommended that between the age of 21 to 29, you should get your pap smear done every 3 years.
Yeah.
And after that, 30 to 65 years, you can get your pap smear done by every 5 years.
Yes.
And there is one more test, that is HPV screening. And WHO recommends that HPV screening should be done for the general population after 30 years of age. It is recommended, and it should be done every 5 to 10 years. And for the women who are living with HIV infection,
Correct.
they should get it done every 3 to 5 years after age of 30.
And pap smear, I want to tell to all the viewers that it is not a test which is very painful. It is just a routine OPD test. It requires a swab stick, and we just need to take a little swab from the cervix. We just need to smear it and send it to the lab. It is not at all painful procedure, so it should not be like
feared about.
Yeah.
So viewers, you have to notice this, because if you want to screen yourself from the CA cervix, as expert has told you, pap smear is absolutely a painless procedure.
Yes.
And it is going to prevent you from a disaster that can happen.
Yes, so get yourself screened for cervical cancer. It's just a small test which is not at all painful, just an OPD procedure, and just get yourself tested for cervical cancer. So can cervical cancer be prevented? Is there any kind of vaccine which is there, or if there is a vaccine, then how do we need to take it? And which are the females who can take it? What is the age group for it?
So obviously there is probably one of the diseases that can be prevented, or this is one of the cancer that can be prevented with the vaccine. And vaccines is widely available nowadays. There are two kinds of vaccine. Those are available widely in the market. There is a trivalent and quadrivalent. So you can check online also. There are so many websites those are giving the options. These vaccines can be taken by the women as early as 15 years or 14 years since the time they start their menarche to the menopausal age. So the whole reproductive age group, when you are starting your menses, till the time you end your menses, you can take these vaccines. And earlier it was recommended that vaccine should be taken early ages, say 16 to 24 years. But now the WHO has recommended whenever you are continuing your sexual practices, you have to take these vaccines. It's a very simple vaccine that you have to take, very small vaccine, and you have to take it 0, 2 and 6 months. Like first dose is going to start today, after 2 months and after 6 months. And it is going to protect you from a very important virus that can cause CA cervix, and that is HPV virus.
Yes. So guys, in short, cervical cancer can be prevented. It is just that you need to do some lifestyle changes. If you have multiple sexual partners, then use contraceptive. That is a barrier contraceptive which helps, which we commonly call as condom. Then, of course, screening test is very important, which is a pap smear. Get it done if you have regular sexual contact. And another thing is that get yourself vaccinated. Vaccinations are available very easily, so get yourself vaccinated. So what are the treatment options available for cervical cancer?
So talking about the treatment, prevention is
Yes.
better than cure.
Yeah,
Okay.
correct.
Because cervical cancer does take a long time from the ulcer to form a cancer. It takes almost 20-25 years.
Correct.
So the patient gets a huge leap of time where they can get diagnosed for the precancerous lesions. Okay, so there are multiple options for the treatment of the precancerous lesion, and that can be reversed. It can be prevented from having a cervical cancer. But then, if you are talking about the cervical cancer treatment, so if you diagnose it early, like carcinoma in situ, that is the first stage of starting the cancer, or stage 1 disease of the CA cervix or cervical cancer, then you can definitely undergo surgical option, and you can have a radical hysterectomy, that is a removal of the uterus and ovaries and some lymph nodes, those are there, and a paracorpus, that we medically call it. So we can get the disease removed, we can screen it on the pathology under the microscope and
Yes.
see whether it is spreading outside or not spreading
What
outside.
stage it is?
Yes. And if suppose it is stage 1, early stage, then chances of survival of the patient is very high.
Very high, correct.
And if suppose your cancer is advanced, then definitely you will have to undergo chemotherapy or radiotherapy. So radiotherapy in the form of a tachytherapy, that is like you get a bigger shots of the light, that is routinely call it, that is almost 25, and brachytherapy, that you get intracervical radiotherapy, that is only for 3 to 4 cycles. And there are other forms, that is chemotherapy, that can also be associated if your disease is progressed. Viewers also have a question, being an infertility specialist, what do you think, does it affect the fertility of the patient after the treatment of the CA cervix?
Yes, of course. It can affect the fertility of the patient when you take this treatment. And of course, we have options available so that the couple can have a kid, a biological child of her own. So before you start this treatment, before you are posted for any kind of surgery, chemotherapy or radiotherapy, you can obviously freeze your eggs. You can undergo complete IVF treatment. You can retrieve the eggs. You can freeze the eggs. And plus, if you have a partner of your own, you can obviously make embryos and keep and freeze them. And whenever you're desirous of fertility, you can obviously go ahead with the surrogacy.
Yes, that is a very important question and very nicely explained. So I think we are done with the questions, and that's it from our side.
And if you have any other queries regarding cervical cancer or any other questions, doubts, you can just DM us. We'll be very happy to answer them.
So there is small little button there of subscribe. You can press that and also press the bell icon. So we will get more motivation to make content and answer such questions of yours, which will be probably help you in your future. Thank you so much.
Thank you.